So good to have you all. I know there's a lot of people on the Zoom opportunity or Teams opportunity, so we're really glad for that. And we have a pretty full house here. Almost every seat's taken, so that's exciting to see. So this is our first meeting of the year. We usually try to do 2 of these. And we're very, very excited that this time we have Attorney General Yost in person to come and open our event. I wanted to just give a little bit about Yost because years and years ago, 8 years, almost to a month or 2 ago, he approached me out of the blue and said, I want you to come over and meet with me. Now, I had the task force with Mike DeWine for 8 years. We were trying to figure out what to do with it. Alicia Nelson was head of Recovery Ohio, and they were talking about trying to make it some other advisory committee, but they already had Recovery Ohio, which I was on. And so Yost asked Melissa Knopp and I to go over, and we went over and met with him. He said, I want to keep going with the task force. And I was like, oh, I'd love that. But I got to ask DeWine's permission. So I met with DeWine. He gave his blessing. We had a handoff, and we went forward with that. And now it's been, we're in our 8th year. We have now almost 500 members. We have 15 committees, which is amazing. I have co-chairs for all 15 committees. And Mike Sheila and Carrie Hotel and Carolyn Bevins back there just kind of keep everything running smoothly. And it's the action arm. If you look over in the back, there are a few of these available, the task force reports. So you can pick one up and take it. It talks about all the things we've done. We'll do one more at the end of this year. There are 3 or 4 from DeWine's era on there. And you look at all the things all these task forces have done, many of which would never have happened in Ohio if it hadn't been for this. So I'm just really, really proud of it and very thankful that Attorney General Yost asked me to continue working with him on this. I just want to make a little plug for him. He would not want me to do this, but nobody interrupts the justice, so I'm going to do it anyway. He has written a book called Stand, An Ohio Life, and it's on Amazon, and I read it. And I've read several books lately written by some politicians and public officials. It's the best book I read. It's funny, it's self-deprecating, it got great stories, it's got some serious stuff. But then I remembered, that's right, he used to be a newspaper writer, so he knows how to write and entertain. And so I highly recommend you, if you're interested, there's some great inside stories in that book that are a lot of fun. So very, very pleased. And then I want to announce one co-chair, new co-chair. Her name is Jordan McLean. She's a Cincinnati court liaison and a doctoral student. She has stepped up to be willing to co-chair with Daryl Graves from ODRC, the Diversion and Reentry Committee, because Linda James, who is here, is leaving Alvis House, going to pursue some new career opportunities, but hopefully stay just as involved in her new opportunities. But we want to thank her for decades of service, both to OJAC and to the AG Task Force. And we want to welcome Jordan to our new committee. And with that, I'm going to turn it over to the Attorney General.
Good morning. It's good to be with you. It's good to be with those of you who are online. And what a change when I first started doing this. We didn't do online things, and then COVID came, and now we tend to do a lot of those things. I have just 2 things that I wanted to talk about with you briefly this morning. The first thing is to say thank you. You know, when I was a prosecuting attorney, I started off with the idea that, you know, I really don't care very much about mental health because if somebody breaks my jaw, it doesn't matter whether they're just an evil dude or they're mentally ill. My jaw is still broken, and, you know, my job as a prosecutor. As time went on, and then accelerating after I met Eve and began to understand a little bit more about how these things work, I realized that that was backward. That in fact, we could keep people's jaws from getting broken at all if we paid a little bit of attention to those who are living with mental illness in our midst. That paradigm shift has been critical. Not that I have, and it seems that we tend to divide in society between those who do justice and those who love mercy. And you're on one or the other side. But it strikes me that justice and mercy are partners in humanity, and we can want to do both. That's what this task force has been about for the last 8 years. This is the last time I will probably have the opportunity to talk to you. I am constitutionally unqualified after next year because of term limits, and we'll be leaving the office. So I wanted to take this opportunity to come and say from the bottom of my heart, thank you for working with me. Thank you for many of you have a political paradigm or political beliefs that don't align with a lot of mine. And it would have been easy to let that become the most important thing and say, oh, I'm not gonna be part of a task force with that guy. Thank you for having your profession and your compassion be the dominant decision factor in your decision, and for working together collaboratively over the last 8 years. I think we have done some amazing things. And we are seeing over $1 billion that came out of our opiate lawsuits that are funneling back into communities, helping with the addiction end of mental health, but really supporting the entire behavioral health system in different ways. I'm grateful for your work, particularly because unlike the cops who get a front page news story or they're at the top of the news on the television news when they make an arrest, or the prosecutors who take the big case to trial and win the verdict, and everybody goes, yay, justice. Your work goes day to day, and you're never at the top of the newscast. Your success is measured one life at a time, and it just doesn't tend to rise to the level where you get the recognition that you really deserve. And I want to tell you that I see you, I appreciate your work. But I also want to leave you, since this is a bit of a farewell, with a warning about something that I see coming around the corner. I am forbidden by law from talking about any specifics, but I can speak generally that our office is working on a number of cases in the Medicaid space, and that there are unscrupulous people, none of whom are on this stream or in this room, who are abusing behavioral health services, behavioral health diagnoses to loot public resources. There are some really big things coming, and I want to ask you to think carefully about how you advocate. There's going to be a public backlash against a lot of the behavioral health modalities that are currently funded. I suspect that there will be a reaction in the legislature. If we hunker down and simply try to defend everything, we may end up losing things that are very important. I think it's going to be important that our first line of defense when some of these fraud cases come to light is going to be not to immediately go out and defend what many people are not very defensible, but instead to focus on the evidence-based practices and be prepared to mount a defense for the practices. It may well mean that there are some things that are currently funded through Medicaid that maybe won't be or shouldn't be because of marginal returns. But I'm giving you a warning about this early because if you think about it and work through what you really need to do your work, I think you will be brilliant in responding to the challenge of the moment when it arrives. I'm concerned that if we just fall into a in the moment response, that we will fail in our larger mission, and more harm will be done. So be aware that that's coming. This group, this network of 500 people that span the ideological spectrum is uniquely situated that as these stories begin to come to light, and we're already seeing a few things in other states that come to light, that we can defend the network that is necessary, the program is it's necessary to defend, to serve this population. All there's to. I have a lot of confidence in you. I've gotten to know many of you, and I think Ohio is a measurably better, healthier place because of the work you do. It's been my honor to work alongside of you on some of those things, and I wish you every continued success. Thank you very much.
While they're still coming in, I wanted to again express my appreciation to the AG that he allowed this task force to continue and grow. We moved 5 more committees under his leadership. One of my most exciting committees is the jail training committee. We is actually a subcommittee of 2 others, and then we spun it off on its own, and we're now in our 11th or 12th training for jails. It's training on using long-term injectables, it's training on understanding suicide, understanding autism. There are just so many things that that committee has done. Committees that could use those, like probation, to use those trainings for them, behavioral health training based on those trainings that are already in the can. And so it's just real exciting to see a lot of things that we have done. So I want to give kudos to Zach. Zach has done Operation Delivery. He had 2 legislators who had to go, as I understand, sign in, get in his car, truck over here quickly to do their presentation, and then deliver them back. And that was a operation that was finely tuned, and he looks like was successful at it. So he's got 2 legislators, State Representative Baker and White, and I'm going to let him give better introductions to them because he knows them better than I do, obvious, but Zach co-chairs this committee along with Lee Russell. So he's doing the first panel and then he's going to do the second. But I want to express my deep appreciation to our legislators for making that effort. You could easily say, no, got a committee today, can't do it. But you would have disappointed 60 people online, all through the leaders and state leaders that we're really glad you're here to share with us.
My name is Zach Holzapfel. I'm a partner at Hicks Partners. I serve with Luke, as Justice Stratton mentioned, as the co-chair for the policy portion of the AG Task Force on Criminal Justice and Mental Illness. Many of you in the room I've worked with in some capacity. I would state that I have both been impacted both on a personal level, but certainly on a professional level. But I've just really enjoyed the opportunity of working with so many different groups and organizations throughout my career on this topic. As Justice Stratton also mentioned, I want to thank both legislators for attending today. Both of them, this was a process. There is a vote in full finance committee today, of which they are going to be intermittent, but have checked in and they will be back on time. So I do apologize for the delay, but thank you both for the time that you have today. I will let you both quickly just introduce yourself. If Representative Baker, if you would want to go first, that would be great.
Sure. My name is Rachel Baker. I am the state rep for the east side and northeast suburbs of Cincinnati. I'm in my 2nd term and sit on Health Committee, Finance, and Medicaid. My background before coming to the legislature, I worked for a couple years as a social worker. So shout out to the social workers. I could not kick it and went back to school and went to nursing school. Worked as a pediatric nurse for about 18, 20 years. And now I direct a nursing research program. So this is kind of children, family, mental health are all my topics and passions. And then I would also say from a personal perspective, I have 3 kids that I adopted from a history of abuse and neglect. My youngest struggles with PTSD. So this topic like really touches me personally. And, you know, you learn everything in school or you work with clients. And then once it hits your family, it's a different reality about what the system looks like and holes in the system. So happy to bring both perspectives.
Well, good morning, everyone. I apologize in advance for this gravelly voice because I came down with some sort of a cold over the weekend, but I did want to thank all of you because you are truly in your professions on the front lines of seeing people sometimes at their worst moments, at their most pain points, and just the fact that you have entered this space regardless of your role. I just want to commend you and thank you because truly you are making a difference. And I know sometimes it's a thankless job where you don't see the results, but the families do and the people do. My background, I'm in my 3rd term already. I can't believe it. I'm from Kettering, Ohio. I've represented 3 different parts of Montgomery County over the course of my 3 terms due to redistricting, but I represent Kettering, Oakwood, Riverside by the Air Force Base, and then downtown Dayton, all the historic neighborhoods, Old North Dayton by Dayton Children's. I have a passion for helping. I did a lot with teen, youth, alcohol and drug prevention, and building positive mental health and supports for young people and families in the Kettering community. I served had my own business for a number of years as a communications and business consultant. I worked in healthcare, and then I spent 17 years in the criminal justice system as an elected clerk of court at Kettering Municipal Court. So back in the day when all the specialized dockets, thank you for Justice Stratton and all her wonderful work in pushing for more of an active role for the courts to be engaged, because otherwise the jails and the ERs and the courts are revolving doors. And so certainly this topic is important. You know, all of us have family members or friends who deal with substance use or mental health issues. And I'm very thankful that we could be here and shed maybe a small amount of light on what you're already brightly shining. So thank you.
Well, thank you both. So we'll start with you, Rep White, since you, you know, obviously are dealing with the voice, and at some point we'll relieve that tension. Where do you believe the biggest discontent between Ohio's mental health system and its criminal justice system, and what role do you believe that the legislature can play in bridging that gap?
Okay, so I think in terms of disconnects, if I want to say Ohio's mental health system and the criminal justice system, the problem, as you all know, is we are treating people with mental health disorders as criminals. We do not have enough resources on the local level to respond. I applaud all the efforts we've been pushing. You know, the governor has been big on the mobile crisis response teams. Certainly, we need more mental health and social work professionals embedded in law enforcement. Because what happens, as you know, is we escalate, right? A situation is out of control, 911 is called. The criminal justice system gets engaged when there could be a handoff. If we would invest more, right, in prevention, preventing a situation from getting to the point where criminal justice has to intervene. So I think there's a lack of awareness and education on the difference we could make if we would just devote more resources to the upfront handling of crises so they do not escalate to the criminal justice system. I also firmly believe that there's been a lot of work done, more judges and probation officers and others understand there's more mental health dockets, substance use dockets, but getting to the people earlier is the biggest disconnect for prevention. And I look at the hospitals. You know, I've had people in my life, they should have been retained in the hospital. They're having an alcoholism issue. They're having issues where they needed to be kept in the hospital. But because of the way our pink slip laws are, because of the way we don't deal with people in the crisis who maybe just needed medicine, who maybe just needed intervention, then it escalates and they become revolving doors. So I think we need to invest more resources in crisis response, have more professionals, and fund more professionals within the law enforcement and the community's crisis response. And we need to keep the heat on the legislature for that. So I call on all of you to get with your local legislators, senators and representatives, and say, look, we need more resources. We could save all this money and all this pain if we would just invest. That's kind of my take on what's missing. And we don't have we don't have enough treatment in the jails, and the transition as someone moves out into the community. And so we could talk a little more about that later.
Any comment to that, Rep. Baker?
Yeah, I ditto it all. I think, investing more in prevention, I would say I'm always talking about Medicaid, holding on to Medicaid expansion that provides funding for so many folks to get mental health treatment, behavioral health treatment. That's all preventing us from getting to that crisis stage. So as much as we can invest in that kind of before even a crisis happens, Medicaid expansion, building our mental health infrastructure so that folks have somewhere to go before they're in a crisis spot. And then I completely agree, funding crisis intervention, crisis mobile. Department of Behavioral Health, I saw, just did a pilot and awarded Lucas and Hamilton, which is great if we can get some good data from that and be able to show those are the kind of investments we need to make. So that when someone's in crisis, I totally understand calling 911. But sometimes that sets off these long-term consequences that then you're in a deeper hole. So if we can work together to make sure that folks in crisis are getting treatment and care versus criminalization. Definitely.
Did you have a question?
Yes. Can you speak more to like the model? Did you say Hamilton? Can you speak more to like the model that they currently adopted, where you said they have more collaboration with mental health?
I was referencing, so the Department of Behavioral Health recently put out awarded two counties, Lucas County and Hamilton County, to trial or pilot an adult mobile response system. And so they are going to be awarded this money to do this and show the state the cost savings. So we'll be collecting data. And in Hamilton, it was really there's probably some people here from there. It's a good collaboration of many of the systems together, working together to come together in this grant and see what we can do as a countywide.
So right now we have those my understanding is every single county has that now or will very soon for young people. Mm-hmm. I'm just wondering what you all think, how that's working. Because the money for the adults to take that statewide is based on this working. So I know we have a schedule and agenda, but I'm curious afterwards, maybe we could talk, find out more from you all, how you think that's working.
Well, I'm going to dovetail on a couple of comments. So one, I also encourage all of you that don't often interface with your legislators, especially being in communities, to be vocal, speak out, engage, talk about where inadequacies are. It only helps further educate. We constantly, at least on the criminal justice side, run into, I can say this directly, in lobbying Representative White in particular, when we talk about community control and community probation, talk about issues that come into funding and data. And so the data is often lacking on a statewide basis as it pertains to that. So I'm going to kind of forecast, and certainly there are folks in the room that will likely have additional comments, but being a pessimist here as it pertains to the upcoming operating budget, we are going to be facing shortfalls in Medicaid and provider reimbursement, as many of you all on the provider side of the ledger who are interfacing and interacting within those communities to treat those individuals who are in that that criminal justice space. My question back to the legislature is going to be, how do you think this group and these communities again, can double back on that education to help explain to the General Assembly, as well as to the incoming new administration, with limited resources, why these resources should be focused on both the treatment community as well as the criminal justice community, because both of them have to work in concert.
I think I think this is going to be key. So, people have their preconceived notions about Medicaid and their thoughts about Medicaid. And I think folks who work with people and receive funding from Medicaid need to absolutely be talking to legislators um, about what Medicaid expansion is used for. When we look at the percent of folks receiving mental health treatment, receiving behavioral health treatment, receiving addiction services, that middle group of 18 to 54-year-olds, that is a huge way that that's being paid for. And if we stop paying for that, what that does to our community, what that does to criminalization, to our jails, to our people aren't going to stop having crisis because we stop paying for Medicaid expansion. So I think helping to paint that picture of the cost savings when these folks get less expensive preventive care versus having to pay for a jail stay, a hospitalization. Um, and I think that until I got really into Medicaid, I didn't understand how important that was. So I think for you all, that, but I don't know that as the legislators, we fully understand how important that Medicaid expansion is for mental health and addiction services. So telling those stories, making sure that your legislature knows, I think is super important.
I would add, how many of you, raise your hand if you actually have talked with or met with your legislator ever? Okay, so that's good. And hopefully next year, all of you will have raised your hand. And it could be that if you don't know them, but you know your judge or another person in the community that you're connected to knows them. Painting the picture of real life stories makes a huge difference in impacting people's lives. And so the more you can have a face with a dollar amount, right? Because it's an item in the budget, but it's people's lives, it's people's stories, people's faces, and they need to know it. We need to know it. And the other thing I would say, and we're not like, we don't bite or something, like most of us are willing to have a phone call or come out and meet with, people at the court or do whatever. And having individuals, family members reach out is also powerful. And coming up and testifying on bills in committee is also powerful. I do think the category, you know way more about this than me, but there will be some people that will still qualify for Medicaid if things are changed and pulled back. And so making sure people are properly categorized, right? And they're keeping up with their the process of enrolling and all of that, looking at the way we do systems and where we might need to hold hands more so people don't fall off that could perhaps qualify under the mental health, like you told me about some of the different categories. So you guys know more about that. Your healthcare providers do. But some of it's people falling through the cracks because they're not filling out the forms right. And we have to spend a lot of time helping people get access to services because they, sometimes it takes a master's degree to be able to figure some of this stuff out. It's ridiculous, right? So I think keeping in mind our systems and our processes, you've heard about like cost of poverty simulations, think about what your systems and steps and processes are through the eyes of the people, the vulnerable people you're serving. You probably do that already, but going backwards and saying, how do we break this process down? What can we change so more people are not losing X or Y, whatever the situation might be, to modify the behavior? Look at your systems and your processes.
So, the final thing I'll say, and there's certainly folks that are going to have opinions and ideas around this, but I know Ohio has constantly, both through legislative action, but also through executive action, has looked at, doing expansion on the criminal justice section for 1115 waivers that will both encompass, jails, CBCFs, et cetera. my understanding, and again, please, anyone can correct me, we currently have, programmatic functionality with halfway houses, but we do not currently have 1115 waiver authority through jails and CBCS. I know that that has been a constant dialogue. I know that there was at one point recently, or at least over the past year, there was a working group that I feel like just disbanded. I'm looking at Teresa to see, because I presume that I know you and your team had activity in that. But that is something that I would just state to both of you as legislators, and I know both of you have an interest and obviously a role, but I do think that the relief provided to local governments, you know, to identify individuals, keep folks out of prison. That's where we have the TCAP program, which I think is a great program. It does a lot of great things, but there is constant engagement from the legislature, and there's the balance between the criminal justice section and the treatment side of the ledger. And there are a handful of bills right now that look at reducing, the criminalization, and that is warranted. But I'm going to raise into, kind of a semi-controversial issue, but I want to raise two different bills right now that I can tell you, and I'll say to the audience, both House Bill 556, which is sponsored by Representative Williams and Representative Adam Matthews, and then Senate Bill 291, which is sponsored by Senator Manning and Senator Reynolds. Essentially what the bill does, both of these bills, and they are companion bills, but it's to support reforms intended to reduce the length and scope of probation and supervision. It emphasizes goals such as reducing unnecessary system involvement, focusing resources on higher risk individuals, and promoting rehabilitation and reentry. But it also argues that more targeted supervision and shorter terms may improve long-term outcomes. All of these things, I think, in general, are productive. They're functioning, they're well-reasoned arguments. The problem is what I'll simplify to the carrot versus the stick, and how those specialized dockets and how those organizations within the community work. So my question is, judges and probation officers have raised concerns about limiting probation terms that could take away some of the flexibility courts currently have to manage cases. How would lawmakers balance criminal justice reform goals and the needs for those judges to tailor supervision based on the risk and behavior of those individuals?
So I'm thinking back when the risk assessment tools were all coming out, and I don't know how widespread the use of certain tools are, in sizing up the individual defendants. But, judicial discretion is the founding principle because one size does not fit all. And I think that the reason why there's been active opposition from many of you as well is because you live and breathe the fact that one size does not fit all. And so while the goals are worthy, shortened, saving money by getting this off or that off, the recidivism and the impact on the families and the community and the workforce is much more costly than not having judicial discretion. So I know that while I support reforms and continuing to provide tools, and I know we tried to get even more money in the budget for things like treatment in jails and some of the different things that you guys are doing to intervene within the criminal justice system. It's very problematic for people who don't understand the system with the worthy goals of getting people out of the criminal justice system. That actually we don't have the community network to support these people sometimes in some communities outside of probation officers and outside of specialized dockets. So until we have the and both and deluxe system, we have to be very careful with tying the hands through legislation that has standards that don't apply in a lot of personal situations.
That's exactly what I was thinking is it sounds great to get people off of probation and out of the system quicker if we had community infrastructure to wrap around them. But if we don't, then maybe that's what we need to hold people, you know. So completely agree. I'd also be interested in seeing the data on how many people are on long-term probation, what's the rate of that, is this really a problem that we need to solve? And does it has it been tried places and do we have data? So completely agree that until we build up that community infrastructure, we had one 1115 waiver in the budget, actually,
Right.
that would help provide Medicaid coverage for the first certain amount of time after reentry. And, until we can be able to hand off to a behavioral health person in the community, until we can make sure that medication management can continue, until people have a safe housing option, just ending probation is just going to, in my eyes, just going to more quickly result in recidivism.
Right. And we got that in the budget. And then there was the federal push on no new waivers. And so I think we need to continue, because things are going to change, but to continue that education of decision makers. And that includes county commissioners and sheriffs who run jails and things like that,
And I think the glass half full part of that story is that as a legislature, we had that 1115
Yep.
waiver in. So
We did.
bipartisan, both chambers supported that. Federally, we heard there were no more 1115, so it's out. But how can we capitalize on that joint? We saw eye to eye across parties and across chambers that this was something we needed to look at. So how can we be innovative in addressing the same thing without a Medicaid waiver? That's a big puzzle, but at least the appetite's there to do it. So would be my
Yeah,
hope. I'm
a good point.
an optimist, not a pessimist.
Well, I'm gonna transition to a broader issue, but I'll try to be refined. So, many different occupations, many different territories talk about provider shortage.
Yeah.
And so maybe if both of you could touch on what would be some of the strategies to help expand specifically the behavioral health workforce, that in an ideal world, if you both could just ring the bell and make things happen. Any ideas, anything that your respective caucuses are working on, or anything that you're looking on through the remainder of this year? I know that there is one thing that I don't necessarily, I'm not asking you both to speak to, but the rural health, um, yes, the thank you, Rural Health Transformation Fund, those dollars. I know that there is a provider focus within that, and certainly within behavioral health, et cetera. But whether it's that or anything else that both of you are thinking about or are looking forward to this year or into the next GA to hit on provider shortages.
So I'll go magic wand. If I had it my way, I think when I think about provider shortage, I think we have a pipeline issue and then a retention issue. So I would look at legislation and funding that approaches both issues. So from a pipeline issue, thinking about starting early, starting in high school, finding folks that have good skills and making this a good profession to go into. I worked with the Health Collaborative in Cincinnati, and they did a virtual health fair where I think they had like 6,000 youth from around the whole state and introduced them to different healthcare fields. It was really cool. But could we do that in mental health just to open people's eyes? When you're young, you're like, I can be a teacher, I could be a doctor, but all these other roles you can have. So that was really cool. But so I think starting young, and then looking at loan forgiveness, looking at scholarships. I had a bill last GA looking at paying folks at a certain income level for their social work internships, asking folks to do a clinical internship with no pay if people are going back to work with the family. That might, so how can we help that burden? So that's all on the front end. And then I would say on the retention end, we worked on bills together, at least in hospitals and healthcare settings, to make healthier environments to help prevent workplace violence. So that kind of work, making sure people have good settings to work, reimbursement, the biggest one. And then I would say, figuring out ways that we can be innovative in the face of potential cuts to things. How can we work in an innovative team-based way, telehealth way, being open to exploring other ways of delivery.
Yeah, that is very good. What she just said, ditto. And the other thing I would add would be, I agree. One of the things I was trying to get this statewide, specifically for the children's hospitals, that there would be paid internships for the social work clinical in their master's program, because you're trying to squeeze that in, and so we only got money for Dayton Children's, but $25,000 stipends for people who are trying to finish well and get a good internship during the day where they're seeing more things. We tried to get some money related to psychologists and putting in money to pay for these internships. We need to keep doing more of that. And the more we talk about it, the more we raise awareness that once you get there, you don't get paid what you should be getting paid. And so it's hard to keep you there. So what's going to entice people? So certainly looking at career tech and exposure in the younger grades. There's several schools are doing like health pathways now. There's actually a movement for all students to take what's called youth science. It's basically a skills assessment and interest analysis. Montgomery County's doing it for every in Montgomery County. But it basically helps people see what they're, leaning towards. And so then you would try to mesh and bring your business advisory councils and you guys getting involved with the high schools, and be participating in career days and pathways and coming and speaking, offering job shadow. That's the whole big push. Career tech, hands-on job exposure. So if you're trying to build your pipeline, you got to get more involved in the high school level. We need to get more involved in funding education so you can get there. And then we've got to keep looking at salaries and burnout. And I know my own daughter is a clinical social worker. She dealt with crime and trauma victims, and human trafficking victims. I mean, there's only a certain amount of time you can do that. So then what's the pathway for that professional? Do we have, one and done, or are we looking at career pathways and alternative things you can do with those skill sets so we get more people to want to go into them long term?
Thank you. So I know we've got a question. I'm going to get to you in one quick second. Well, I just want to, again, thank you both. I think maybe some closing, comments, if I were to wrap it up, is number one, all of you utilize your voices to communicate to your legislators, communicate about how things impact the work that you do, the community that you're engaged in. I think as we look towards the upcoming operating budget, I think we've all recognized that here, at least at the state level, we are going to deal with a constricted, or most likely a constricted budget. So how the state legislature and the incoming executive decide they want to appropriate, again, I am a big believer in the squeaky wheel gets the oil. So however you choose to utilize that, but do not miss your opportunity of engaging with your local elected officials, your state legislative officials, etc. Any additional comments?
And the more
Please.
you can consolidate around a few key priorities, the more successful you will be, collectively.
Any parting comments?
I agree.
Yeah. Yeah. The only other thing, and again, Rep White has drilled this into me over the years, also, where you can get localized data that speaks specifically to your legislator, it is significant. There are a handful of them that is a routine question in which they ask. So I strongly encourage you all to bring that. So with that, we'll open it up to questions. And
thank you, sir. I know Reverend you mentioned some things about supporting professional pathways and also scholarships. One initiative that was in the state of Ohio, where it was the Great Minds Fellowship, which was meant to basically help students that were working in behavioral health professions. It was supposed to support their educational pathway as a mature health professionals. That was supported by ARPA funds, so I'm not sure if that's still something that is currently in motion, but is there anything or any possibility for something like that, or any additional investment in that kind of investment for education?
I was thinking about the Great Minds Fellowship. Are you aware of that
Yeah,
program?
yeah.
Okay, go ahead.
But I don't know where it stands.
I think that they had talked about that I might be wrong on this, that they did have some money left to spend down, but by the time the next budget comes around, I'm sure it's gone. And I might be wrong on that. But I think that I was thinking of that exact program when you look at that, but you apply through your college or university. And so you have to get into that school, then that you have to get it through your school, as opposed to having a broader bucket available. But we need to do that because if we keep complaining and not changing and getting the same results of not having enough workers, you got to put your money where your mouth is.
Yeah, I would agree. I don't know where it stands right now, but I
Right.
would think with ARPA dollars, we're pretty much near the end. I think we're in this tight spot of ARPA dollars ending, knowing that we're going to have a more constricted budget. So priority, that's saying like it's not a piece of pie or it's not a pie. This really is a pie. Like we need to figure out our priorities of where we're going to put money. And I feel like recently any talk of expanding anything is like, hold on, let's see what we're going to have. But we need to invest. I think everybody recognizes there's a workforce shortage here and we need to invest in it. So I think it would be amazing if we did something like that at a state level, where everyone has access. We'll see.
But I think the elephant in the room is, why are so many young people struggling with mental health problems, right? And we just approved recreational marijuana in this state, and the incidence of psychosis and things like that with early use. We are basically, I'm thrilled to hear about all the work being done with the marijuana education and the additions with One Recovery, One Ohio. But just what we have to do is we have got to stop the flow of people needing at the same time we build the workforce, because we have got to do more to educate parents and educate young people and help educate on the dangers and the risks related to social media and all of the things that are bombarding our kids. So we've got to do that in both approach, because we will not be able to ever have the workforce with the demand that is coming. We've got to slow that demand or stop it ideally. But any thoughts on that? Any ideas you have, we'd welcome you talking to us more about that as well.
That's such a good point. We focused on mental illness or mental health issues, and we didn't really go even all the way back to social determinants of that, right? Like we could decrease the workforce issues, decrease the crisis, decrease the criminal justice if we went all the way back and had supportive infrastructure to address trauma, to address poverty, to address, so we didn't got that at the end. But that's ultimately what we need to do,
Right.
and that could help all of this.
Right.
Yeah, great point.
Any other questions? What is the best way for us to get involved in speaking with legislation or legislators, and how can we start? So, as two legislators, what do you think the best way is for community folks, whomever those may be, to connect with not only you all, but also your colleagues, just holistically?
Well, go ahead. Do you want to start?
Sure. So I would say starting with your own legislators is a great place to start. Building a relationship. You guys have the skills and this is what you do, right? You build rapport with people, you communicate, you educate. So doing that with your own legislators, and I would say even before, maybe this is pie in the sky because I think we might be a little bit in crisis, but even before the crisis, if you can start to build a relationship. So the first conversation isn't like, this is the worst thing ever. And if they know you're reasonable. So I would say making sure that you start to build a relationship with your personal and where you work, your clients, state rep and senator. And, I think as far as how calling, emailing, all the things work, we're lucky enough to work, statewide, but locally enough that I often have coffee with folks in my community. So meeting to like really hear about your work, what you do, and start to build that trust and rapport so that when you need to come and say, this is a real problem or this is great, coming when things are great is good too. You already kind of know each other and have some trust built.
Well, and along with that, following what's going on. So, I know Zach and others interface with you all and help you stay on top. I see some faces here who are very actively engaged in Columbus. The more that you stay on top of what's happening, and just so everybody understands, a bill is introduced. It's available on the Ohio channel for consumption. You can watch hearings. We give our sponsor testimony. Then there's proponents who come in. Then there's opponents who come in and speak. And I will tell you, it's much more effective to come in person than to submit written testimony, because you're standing in front of people who are going to be making the decisions. Granted, some bills you might have 50 written testimonies on. Realistically, are you going to be able to get through all of those and fully grasp the emotion and the intent? And then you look at emails. Personalize your email. Pressing click on a generic email that goes out and your email is the exact same is not going to get noticed as much as you writing to the legislator in your district, your local, here's what's going on, and sharing your views. But literally calling our offices and saying, I don't know if Rep. Baker has time, but I'd love to have a brief meeting with her in the district or talk with her on the phone. We both drive back and forth, right? She's coming from Cincinnati. I'm coming from Dayton. I drive every day. I usually don't spend the night. So I have that time in the car where I handle a lot of phone calls as well. But some legislators are not approachable, but the vast majority want to know what you think, and they want to serve their constituents to the fullest extent possible.
Thank you both. There's a couple more questions. I tried to answer one, and I think that it was also answered in the chat. There are a large number of cases charged against people with mental illness from within the very programs meant to treat people with mental illnesses. Are we at risk of continuing to criminalize mental illness? Example, in the heat of a psychotic break, a patient spits on a hospital staff and is charged with a felony assault. I don't know how deep you all want to get into that question. I think it's a fair question. I think that this comes back to the item around both of the bills that we raised in the chat. Again, each circumstance, each situation is its own experience. And obviously, again, legislators sometimes are reactionary to unique situations that come up. I think those of you that interface with a lot of situations and scenarios, it's imperative for you to educate, at least on a balanced perspective, to legislators through the different organizations, through your employers, however you have an ability to communicate. Because again, the difficulty that I think that the legislature has is trying to legislate every unique circumstance is often unbearable. It is impossible to legislate out of things. You have to give flexibility, you have to give functionality. And again, for every situation on any of the two bills that we mentioned, we can give you case examples on both sides of the ledger, the folks that are proponents of the bill, the folks that are opponents. And those are ultimately the actual decisions that legislators have to make. And so, I don't think that we're viewing the criminalization of mental illness. But again, I would argue to all of those specialized dockets and those court administrators, those court teams in particular, they are devoted to trying to identify and to help those individuals coming through those systems. And again, you have unique judges, you have unique treatment teams, and they all are not equal. They are not equal on resources. So I would just say, right now, there is a balance within the legislature, within the discussions on giving that local authority and control. And I think it's working. But until there is a perfect system, with flush resources to go around, You know, the system that we have right now is aimed at targeting getting those individuals into treatment and back into the community in the best way they possibly can. Any comments? Because I know we're about at time.
Smiling at each other because our workplace violence prevention bill that we passed last year, this was like the biggest sticking point in committee. It was someone wanted to add criminalization of spitting bodily fluid on workers, which we understand. And we saw the other side of criminal, you know, and eventually did not add that to our bill. Because we needed so much more to work through it because we see both sides of it, you know.
But part of that bill is for professionals within a healthcare system to sit on a committee and establish policies that work within that facility. So that it is basically, you know, a lot of healthcare workers was like, I don't want to charge someone, right, if they are in mental health crisis or they're high on meth or something. But at the same time, there needs to be expectations and protections and security and training on how to de-escalate and all of those other things. And there are circumstances where things do need to be charged, but to make it too broad brush that anytime fluid is thrown on someone, they're going to get a felony. Well, we don't know all the circumstances around that.
So we've got one more question. I will answer it very quickly, or at least attempt to. And again, feel free to chime in. But this particular Samantha Brown, I have called and only been able to get voicemail. So if anyone has a better, reliable way to get in touch with legislators, that would be helpful for Franklin County. I'm going to make a broad-based statement. There is email mechanisms for all of the state house offices. I think both emailing and leaving voicemails. I would also, you being in Franklin County, you have the luxury of having multiple legislators in Franklin County. One little snippet I would do, which they might not like, is email them all at the same time. Put all of them on the email at the same time. Also, you have your respective senator. Again, you have a smaller number of senators, but there's, you know, be a squeaky wheel. They will return your call at some point. I promise they will.
So the Ohio General Assembly website has the ability to look up your representative or senator, and then you can actually send an email message through that as well. So there's that. But I mean, everyone is not perfect, and you can get lots of calls in certain time periods, but persistence is really important too.
But our two state reps up here always return calls.
Are either of you familiar with the Stepping Up program in your county?
A little bit.
I would highly recommend you get very involved, because the whole object of the Stepping Up program is to get what you're talking about, get the front end, get people who cycle over and over out of the jail system. Both of your counties are Stepping Up counties and have had multiple meetings that are conducted in the counties. I'm going to give you some packets to have your staff read. This is an infographic all about the Stepping Up program.
Great.
It tells you. And then this is just a summary of what this task force has done just in the last 2 years. And then in this infographic, one of the most important infographics is on housing.
Yes.
And it's what we call making the business case. And it shows that we actually looked at all the systems. This one guy who spent 8 years, 400 days in a hospital, 500 days in a jail, 1,000 days in prison, cycle, cost the county $641,000 over 8 years. And finally got him a supportive housing with full supports. And he's not been rearrested, he's not been rehospitalized, he has a job and a girlfriend. And it would cost them $244,000 over 8 years, because nobody counts the jail pickups. So
Right.
Yeah.
it's this and that. When you add those together, you can really show. So I wanted to have your staff really look at that.
Thank you very much.
So I'll give both of these to you.
Well, and I would add, we had talked about housing, and often what gets cut in my own county, I met with one of the providers who told me, we got our funding cut from our Adamus board, you know, and we're going to have to close our permanent supportive housing if we can't get more funding. So what's that ripple effect of not funding stable housing? And so the more we can understand those things, the more we understand the business case. I really would appreciate having that. Thank you.
Justice Stratton, thank you. Thank you all very much.
Okay.
The second panel is going to be more focused on policy and some of the policy issues. We've had some real leaders in the policy space here. So it's really very, very important that they can share with us, and they can be some of the leaders to put some of these constituent groups together to lobby the legislature. We can just kind of focus on those priorities.
Okay.
I'm really excited to have them. We're going to have Luke Russell be one that introduces all of them. But Luke he's part of the core team of Stepping Up. So he attends all of these meetings that we have. We have usually 2 a month, and has the local NAMI representative keep his dad. It's just been tireless to work with, like I did with his dad from the very first day I started doing any of this work. So we appreciate it so much.
My name is Luke Russell. I'm Executive Director at NAMI Ohio. We have 38 affiliates. They represent 85 of the 88 counties that do education support grassroots work. I will say this, we're the largest state NAMI in the country with the most affiliates. And this year we will serve over 50,000 individuals through our programs, signature programs. Our involvement here is NAMI Ohio represents all people with serious mental illness and their families. And that includes, again, the folks that are involved in the criminal justice system. Unfortunately, we have to have this kind of meeting because so many are involved. I use a number. One day I was sitting in my office and I was getting ready to do a similar event like this. And I added up the number of people in Ohio prisons with serious mental illness is around 10,000. It's about 27% in jails are on psychotropic medications. Another 6,000 to 7,000 homeless people have serious mental illness. That number is about 26,000. When we deinstitutionalized in the state of Ohio, closed the state hospitals, it was 26,000 people that left those hospitals. So as Governor DeWine has said on multiple occasions, the system's not broke. We don't blame the people that are working the system. It was never built to handle the seriously mentally ill, particularly the adult population. So we just believe that people with mental illness deserve help and not handcuffs. As I listened earlier, one of the things I have a son with developmental disability. I worked in the Arc of Ohio. We would never take someone with Down syndrome who spit on someone and throw them in jail. It never happened. But we'll take someone with schizophrenia who's hearing voices and do it, and we'll throw them in jail. So just the food for thought. And one of the nice things is this is actually NAMI Ohio or NAMI National just released, and I have it on the back table there, a report on public policy throughout the country. It was just published, I think, yesterday or the day before. Great timing for this event. And it shares different areas. So if you want to take one of those with you, fine. There's also a toolkit for those that are advocating for individuals with mental illness in jail. It's back there. Or email luke@namiohio.org, and I will send you an electronic copy. But that being said, there's about 2 million people each year with serious mental illness that are booked in jail. 2 in 5 people who are incarcerated have a history of mental illness. That's double the rate of the general population. And again, as I mentioned earlier, we're sharing some of the policies that are out there. We believe that instead of charging people, that we should support policies that address the underlying need. And we already heard that earlier, which was really interesting. Supportive housing, day treatment, diversion strategies, mental health courts, alternatives to incarceration, giving judge and prosecutors and police the discretion to not criminally charge somebody, an individual who might end up in their system. And again, NAMI Ohio, we deeply appreciate the work that Justice Stratton has done with the Stepping Up program. We're very involved in the CIT program to train officers. Both of those programs, I would argue, in this country, with our criminal courts and our mental health courts and our other diversion strategies, as well as the Stepping Up program, half of all officers in Ohio are trained in CIT to deal with individuals with mental illness. That number, we can't tally up how many people have been diverted from the system because we have police officers who have compassion. I've been through the training. I've sat with the officers. It's unbelievable, really, to see when they come in on Monday morning, they leave on Friday. Their view of the world's much different, which is awesome. And then obviously the grassroots advocates that are up here, our providers, our boards, our other folks who are really working to try to champion solutions. And we even heard, a Democrat and Republican talking about, what are some of the things we know work? We don't need to reinvent the wheel. So Obviously, our involvement here is we want to thank everybody involved, and we will take questions at the end, and I've got some questions I'm going to ask, and then we'll try to do this thing up here too. So I watched them kind of struggle with the chats, but feel free to put in the chat if you're online a question you might have. So with that, I'm going to ask, we'll start with Teresa and we'll work our way down for you to introduce yourself. And again, share your involvement, your organization's involvement, or how your organization's involved in criminal justice stuff.
Well, good morning. I'm Teresa Lample. I'm CEO of the Ohio Council of Behavioral Health and Family Services Providers. We're a statewide trade and advocacy organization that represents over 170 of Ohio's community mental health, addiction treatment, family service provider organizations. Statewide, my members, just to kind of create a little sense of scope, employ over 40,000 professionals who provide care every single day, and we're serving over 2.5 million Ohioans. That's a lot of people that we're trying to serve, and as you all know, the demand for care is exceeding the capacity we have to serve. If you think about the impact of mental illness today, it's anywhere from 25 to 40% of the population. And I think given the environment that we live in, that's focused on a lot of divisiveness, a lot of impact of social media, we continue to see more demand because we all live in this kind of echo chamber where everything feels like it's out of control. And so I think that, what we're doing today is really trying to meet the needs of people. Our organization believes that we need to really focus on integrated, comprehensive behavioral health care. And that starts with prevention, as you heard both representatives speak to today, earlier intervention, and then the treatment responses, but also the support services, whether that's housing, and housing was mentioned as a critical support, but also food and transportation, and being able to help people, meet their basic needs. At some point, it comes back to Maslow. And you can't expect people to be able to function and think about cognitive behavioral therapy and changing their thought processes when they're worried about where am I going to sleep tonight and where am I going to eat or how are my kids going to get what they need. We also very importantly believe that we need to have a more comprehensive approach on brain health. And I'd really love to see us start talking about this as brain health and not mental illness and substance use challenges. But if we're talking about brain and normalizing treatment of the brain, the same way we treat the heart, the lungs, we can talk about breast health and prostate health, but we don't talk about brain health without the stigma attached to it. And so if we start to do that, then we can start to really look at how do we have a healthcare response when people are in crisis or in need, rather than focusing on a criminal justice response. And I think that's the overwhelming theme that we continue to hear today. Crisis services is a big part of what we do and a big area of focus. And then being part of we were part of the governor's competency restoration process. We know we have more work to do because people find themselves at the intersection of a criminal justice, of law enforcement, because of their mental health condition, rather than getting into a healthcare place. But 988, and I was really kind of surprised that 988 was not mentioned this morning by our legislators. That's a critical service that we've been building that is different from 911, but provides the level of support. And it's actually a service, and making sure folks understand that 988 is a service. It's not just a dispatch. It's not just getting a first responder. It's a service that helps people connect to care, many times solving their problem over that phone call and then getting them into where they need to be. And then having some place for people to go if they do need a place that's safe, where they can get care, and not, a cell. And then, finally, I think that it really is, and this was mentioned earlier, early intervention across the spectrum, starting with our children and young people, but also making sure we have that access for people at all stages of life, whenever, that brain condition is showing up and we need to be able to respond.
I'm Joan England. I'm the executive director of the Mental Health and Addiction Advocacy Coalition, and we do a ton of work with these folks as well. We're honored to partner with everyone. Our organization is statewide. We have over 130 member organizations all around the state. What makes us singularly unique is two things. We do local work in Northeast Ohio in 7 counties, and local work in Southwest Ohio in 6 counties. So kind of the Northeast corner and the Southwest corner. What that allows us to do, and when I say local work, that means working on local levies, working on county budgets, being involved in local opiate task forces, suicide coalitions. So we're deeply in those communities, meeting with mayors and commissioners and sheriffs and local police chiefs. What that allows us to do, because we also do state work, right? Out of our work in Columbus. So working on the operating budget and 295 that just passed, so state level work, that allows us to understand the interplay between local funding and state funding and local policy and state policy. We see it every single day. We can connect those dots for legislators and for community members. The other thing that makes us unique is our membership. We're able to saddle up next to Teresa and saddle up next to Tony because our membership is different. We are a big tent organization. Any organization that has any interest in behavioral health is welcome. We have hospitals, we have courts, we have schools, we have the faith-based community, we have managed care in our membership. In addition, we have providers and Adams boards. So the uniqueness of our membership is also a hallmark of the MAC. We do a lot of work at the intersection of mental health and criminal justice because, again, we have our feet in those local communities. I sit on the board for the Diversion Center in Cuyahoga County. We're also involved with the Crisis Center build out in the local communities. We also do work at the state level. I mentioned 295. That's the competency restoration bill that just passed. We were very involved on that. We also do a lot of deep end research. I see one of our former partners, Center for Community Solutions, Kyle, is here today. We authored a report that if you haven't seen, I might encourage you to go to our website and take a look at. It's called By the Numbers 4. It specifically looked at the intersection of behavioral health and criminal justice. We started with a primer. I'm a lawyer. We started with a primer. What's the difference between a prison and a jail? Did we know there are 5 types of jails in the state? In order for us to really begin to talk about these things and how we can make an impact, we laid out the entire system for folks to be able to take a look at in 5 installments. And there's also survey data in there that is really unique and interesting as well. So I'll pass to you. You can hold.
I think it's a caterpillar. That's what I'm hopeful for spring. My name's Tony Coder. I'm the CEO of the Ohio Suicide Prevention Foundation. I also work closely with Luke and Teresa, and I see folks from the boards and Joan and folks. And we don't represent a system. I work more with families and those folks impacted by suicide across the state. We lose 5 people a day to suicide in the state of Ohio. 80% of those are middle-aged guys. And we also get about 25 to 30 suicide attempts a day coming into our emergency rooms, and about 200 and 210 suicide ideations coming into our emergency rooms every day in the state of Ohio. So we try to work with a lot of those folks and get them to providers and to NAMI and to boards. I became involved with some criminal justice was actually through Director Chambers Smith. She is a phenomenal, in my opinion, advocate for folks with mental health issues, as well as the director of the Department of Rehab and Corrections. And she called me to say, we've seen an uptick in suicides in our prisons. What can we do to help? And so we met with some folks, gave some suggestions, but then it really hit home. Much like Representative Baker was talking, it's one thing to talk policy, another to talk people. And got contacted by a family. Cameron was their son, died in prison, by his own hand. And Annette, Director Chambers Smith, let me actually go through the process of what someone goes through when they're suicidal in the prison. He actually said, do not tell anyone, Mom. He told his parents that I am feeling this way. I'm going to do this. And his parents were going to say something, but then he said, please don't. They will treat me even worse than going through the system. So got to go through what someone who is suicidal in a prison system goes through. and was not a great experience. Some of they isolate you. They take your clothes and put you in this. It looks like a big moving blanket, for lack of a better term. It's just big moving blanket, and somebody watches you the entire time. Suggested some things to Director Chambers Smith, and hopefully we can do some things to improve conditions for folks who are suicidal in the prisons. We are also creating, working with prisoners, inmates, folks who are incarcerated on an app that would be placed on their system, in case the folks who are walking the floors or the peers can't get to them. Maybe it could be something that could be on their tablets for wellness and things like that. So we are working with the DRC on that. So now to you. Oh, you got your own caterpillar.
Thank you. Excuse me. Good morning, everyone. My name is Tiana Johnson, and I am the Chief Probation Officer for the Hamilton County Court of Common Pleas Adult Probation Department in Cincinnati, Ohio. I am grateful for this opportunity to be able to participate in this very important discussion convened by the Ohio Attorney General's Task Force on Mental Health and Criminal Justice and moderated by NAMI. I'm also very privileged to be participating on behalf of my colleagues throughout the state of Ohio through my membership with the Ohio Chief Probation Officers Association. So I am here today representing the field of community supervision and probation throughout the state of Ohio. The Hamilton County Court of Common Pleas Adult Probation Department supervises individuals that are placed on probation supervision by 16 honorable judges. On any given day, our department supervises approximately 2,500 to 3,000 plus individuals that are placed on supervision. Our work sits, probation as a whole, our work sits at the intersection of public safety, behavioral health, and rehabilitation. And we recognize that many of the individuals that we are servicing under the court supervision, they present with very complex needs, including mental health conditions, substance use disorders, trauma histories, which is huge, and any other social determinants that influence behavior and instability. Because of this reality, our probation department works very closely with the court and various community partners to support problem solving and treatment-oriented approaches within the justice system. We are very fortunate in Hamilton County to have several resources at our disposal. I oftentimes state that Hamilton County is resource rich, and we do not take that for granted. Yes, there are areas in which we can improve upon our responses, but we definitely have various services at our disposal. And again, we do not take that for granted. The Court of Common Pleas currently operates various specialized dockets that are designed to address underlying behavioral health needs and promote accountability, while also supporting recovery and stability. Some of the specialized dockets that we have in the Court of Common Pleas are, we have 4 mental health court dockets operated by 4 separate judges. We also have 1 drug treatment and recovery court. It is actually the first of its kind in the state of Ohio. We also have a veterans treatment court, a reentry court docket, as well as a commercial court docket. And through all of these specialized dockets that we have, probation officers play a very critical role in connecting individuals to mental health treatment, as well as to substance abuse treatment, coordinating services with the different providers within the community, applying evidence-based supervision strategies, as well as supporting behavior change, while also simultaneously ensuring public safety. That is our ultimate goal, is to ensure public safety. Our involvement in the broader mental health spectrum and criminal justice system reflects our court's commitment to ensuring that supervision is not only about compliance, but it also is about supporting access to treatment, supporting stability, and supporting long-term positive outcomes of our clients. That is part of our department's mission, and we share that across various probation departments throughout the state of Ohio. So again, I'm very honored to contribute to this conversation and to share perspectives from the field of community supervision, as we all in this room and online here, as we all collectively work to strengthen the response to mental health needs within the criminal justice system. And in preparation for this particular panel discussion here, I consulted with several of my colleagues throughout the state to ensure that the perspectives that I provide to you today represent a holistic view of probation and community supervision throughout Ohio. Again, happy to be here today.
So you can tell we got some dedicated folks on our panel. I had a board member, he's retired now. He used to say friends help friends. And I was just thinking about some of the comments made, Justice Stratton taking on this role to really advocate for mental health courts. I've sat in a mental health court with NAMI folks who are helping families as they're going through that process. You mentioned Director Chambers Smith. Full disclosure, I was high school with her. I always joke with her. We were in no classes together. She was an honor student. And she says, I know. She's a pretty direct person. But I'll never forget sitting in a meeting with her. Well, number one is walking out of the state one time, and she's like, I'm the largest mental health provider in the state. What are you going to do about it? That's what she said to me. But one time I was in a meeting, and she was like, we're going to train all of our correction officers in CIT. And then one of her staff, who had been there for a long, long time, said, okay, we'll look at that. She goes, no, that's a directive. That's not we're going to discuss it. And I think within about a year, she had 1,800 correction officers trained in crisis intervention. Mm-hmm. And it just showed me all it takes is the right people in the right place to make a difference. And again, we're a local run state. So you got to have the right people in each community, unfortunately, the way we're operating, or fortunately, how you look at it, to make things happen. So I'm going to go ahead and start, Joan. I'm going to start with you, and then we'll go this way. We'll keep jumping. Mm-hmm. Okay. Second question, why are people with mental illness overrepresented in law enforcement and prison jails? And what role do you think the mental health system and these divergent systems play in that?
Yeah. For this question, I had like 42 things written down, and I'm thinking they're all very similar to what, so I'm going to pick off like 5. Maybe each of us can do 5, and we'll fill out the list perhaps here, so you don't listen to me drone on and on. But we saw it with the example in the hospital. One of the reasons is the criminalization of things that can be so associated with a behavioral health episode. We'll call it an episode, right? The spitting, the not subduing as quickly as one should subdue, the verbalizing of things. It is that criminalization. On the flip side sort of that is that we have historically also tried to arrest our way out of substance use disorders. The response has been historically, you have a substance use disorder, we are going to arrest you and we are going to minimize this thing, whatever it is, whether it was the crack epidemic, that's what we tried to do. We only stopped doing this at the level that we had previously when we were faced with the opiate epidemic. And communities that perhaps in the past had not been hit were being hit by the opiate epidemic. That's the reality of what was going on there. So we've got to stop trying to arrest our way out of substance use disorders and other addictions. I'll leave some of these again to these guys. The one that I did want to lift up is, we also need to look at sentencing reform. Right? Really take a look at that and also look at bail bond reform as well. And we need to be really focused on how long people with behavioral health disorders are sitting in jails compared to people without behavioral health disorders. All the studies show they're sitting there for a lot longer. We all see it at the local level. We need to address that. We need to own it and address it and figure out what the problems are. We know what a lot of the problems are, but we need to address them. The final thing that I would just lean into when we think about mobile response in communities, we need to be leaning into, I'm speaking to a couple folks up here that really know this, 988. We have to be talking about 988. We have to be utilizing 988 at the local level. And within response teams, we need to be actively working to include clinicians and peers and not having folks with guns arrive on scenes. We have to actively work that in local communities. I'll defer now to, who do you want to go? Tony?
Mine's from more of a personal standpoint. My son struggled with suicidality, and it was my son changed, and I didn't recognize my kid. And to me, I think society is, and not, I think the two politicians we had up here today are phenomenal, but there is a political view that it's easier to lock somebody up than it is to send them to treatment, and that's horse shit. Frankly. Are we allowed to curse on this?
Yes.
Okay, thank you. So I thank God that my son didn't do something to get himself sent to prison, because now, 8 years later, great medication, phenomenal. Talked to him last night, treatment. He works for an absolutely wonderful employer. Is living his best life, girlfriend, just bought an Alfa Romeo, all that kind of crap. And it's just, he wouldn't have got that opportunity if he would have been put in jail. So I think we have to change to your point of that it's easier to lock folks up, or, then we have to change that and understand, to Teresa's point, this is a brain issue. And we don't do this for folks with developmental disabilities. We don't put them in jail. We don't do it for heart patients just because somebody has, diabetes and, passes out because of whatever, because our blood sugar. We shouldn't do the same we shouldn't do that for folks with brain health issues. So from a personal standpoint, I thank God that you all do what you do, because you saved my son's life. So every day, every Thanksgiving, I get to have dinner with him. So thank you so much for what you do. Thank you.
Okay. So I believe that the overrepresentation of individuals in jails and prison is it's a combination of reasons for such. I think that the criminal justice practices that we have in place, combined with social factors as well as systemic gaps, all contribute to the overrepresentation of individuals within our jails and our prison systems. However, I do believe that when treatment and crisis response and supportive services are insufficient, unfortunately, jail becomes by default the responder. And I think that there are things that we can do to change that, but unfortunately, that is the reality of the situation current day. So if we strengthen our community mental health systems and expand upon, I believe in evidence-based practices wholeheartedly. If we expand upon evidence-based diversion programs, these will be essential policy changes that will help to strengthen and improve outcomes for individuals that are suffering with mental health issues. I believe that untreated symptoms that lead to criminal justice systems also need to be addressed. Again, by default, we have individuals who are displaying symptomatic behaviors, but they are being criminalized as criminal behavior and being treated as such. And individuals are incarcerated as a result of such, when it was literally symptomatic behaviors resulting from their mental health issue at that point in time. And some of those things are disorderly conduct, public disturbances, substance misuse, because a lot of individuals self-medicate through substance use, especially if they are not properly medicated for their mental health issues. Also, non-compliance with rules or authority, and homelessness related issues. Again, this was talked about earlier in regards to homelessness, going back to the social determinants of health to find out what are the underlying issues that this individual is presenting with that we need to tap into. So those things are just a few of the ways that I think that we could certainly address the overrepresentation of individuals in prison and in jails. We cannot have this discussion about mental health without also including a discussion about substance use. I believe that, and I know that someone on this panel had brought this to our attention, they overlap so heavily. Co-occurring disorders are a real thing, and we need to address them as such. Because when you have an individual that already presents with a mental health issue, and then you pile on a substance abuse issue on top of that, this intensifies the psychiatric that person presents with. It also increases risk-taking behaviors and impulsivity, and it leads to violation of an individual's probation or their community supervision terms. So these are things that we certainly need to be aware of. Additionally, we are criminalizing poverty, homelessness, as well as crises that individuals that they're experiencing. Housing instability, they have limited access to healthcare for varied reasons. Trauma histories, I talked about that in my introduction. Trauma plays a huge part in the experiences of the individuals that we all work with. So just to name a few, those are the things that I think contribute to the overrepresentation of individuals within our jails and prisons.
Teresa?
I think I like going last. So ditto everything they said. A few points I want to just kind of piggyback on. I do think we've entered an era where the stigmatization and the criminalization of people is dangerous. Anyone with a mental health issue or substance use issue, particularly if they're homeless, we have public policy right now that is framing that as dangerousness. And I think that is going to be something we have to be intentional in reframing that these are illnesses. This is a brain health condition. There are treatments, there are medications, there are things we can do. And we have a lot of challenges in the social economic factors. We're criminalizing poverty. We're criminalizing lack of affordable housing. We're criminalizing, a lack an experience of trauma. And if you look at the overrepresentation of our veterans in the homeless population, that's something we really have to think about, because where we find that that's where they end up then also being arrested. And so if homelessness is now going to be a reason to be arrested, we're going to compound the problem. So I think that is something we have to be very intentional around in thinking about this as a healthcare response. In my ideal world, we're not talking about diversion, we're talking about prevention and early intervention. By the time we're getting to diversion, we've already moved into a criminal justice response. So it's really looking at, and I think, Luke, you mentioned it, and the governor, Governor DeWine has been really powerful in saying our system isn't broken, it was just never built. And that's very true. It really is. We really need to think about the lack of capacity, the lack of workforce, and the lack of investment that's been made in behavioral health for the past 40 years. With deinstitutionalization, the dollars didn't follow. And so now we're trying to catch up, and we have this really interesting tipping point where we're more comfortable talking about mental health and substance use conditions. We know that we need to get treatment. We know treatment works, but at the same time, we're kind of also back to this point of, but we just want those people out of sight, out of mind. And so how do we prevent a return to institutionalization, particularly in our jails and prisons, as part of the solution? How do we actually keep the momentum to build the interventions, to build the preventative practices? 50% of mental health conditions start by age 14 and 75% by age 24. So we have we have incredible opportunities to think about on the front end. How do we start to identify early? How do we intervene? We know young people, if you have a diagnosis of ADHD, even into your early 20s, before you're diagnosed, there's a higher likelihood of alcohol use and substance use. And as marijuana is more prevalent, and kids today think marijuana is medicine, it's not, we are creating scenarios where we're continuing to foster illness instead of wellness. And so how do we start to think about the investments in those social determinants, in earlier intervention, and building the capacity that we need? We need housing. We need crisis services. One of my members who's now operating a crisis receiving center in Northeast Ohio, what they have found is with that center being available and with their partnership with law enforcement and sending either a clinician or a CPST care coordinator type or a peer out with law enforcement, they're bringing people into that center and never getting them into the criminal justice system. And in doing that, they've seen calls to 988 increase, and they have seen a significant reduction in their need for mobile response because they have a response system that is using typical pathways, but bringing people into care instead of taking them to a jail. But how do we finance that? And that's the other thing we don't really talk about enough is right now, the majority of services for mental health and substance use are paid by Medicaid. And you heard the Attorney General say there's been some bad actors, and we have to deal with the bad actors in a way that says we're not going to do this, but not punish everyone else who's doing the right things and trying to serve people who are very difficult to serve, who have a lot of challenges. We also need to make sure that employer-sponsored insurance or commercial insurance is actually carrying their fair weight, because I bet many of you don't know that if you have a crisis response and it's a community-based response, employer-sponsored service insurance most of the time doesn't cover that. Getting access through your commercial insurance for a therapist or an assessment takes almost 3 times as long. Why is that? Mostly because they don't recognize the full array of workforce that we have available. And when it comes to reimbursement, it's 25 to 50% less than what Medicaid pays. And in most other healthcare systems, Medicaid is the least favored payer. For behavioral health, it's the preferred payer. And why is that? And I think it all comes back to stigma. So, that which gets paid for happens. And if we need to build the comprehensive services, we need more ACT teams, we need more intensive home-based services, we need wraparound support, we need the housing and supported housing and supported employment opportunities to get people back to feeling like they're part and contributing to society. But we don't pay for it. And so making those investments is going to be really important, because I'll say it again, 25 to 40% of people in any given moment are dealing with a mental health or a substance use condition. And there's lots of impacts on our economy and on our society if we're not treating them and helping people be as healthy and well as they can be.
Yeah, I think, Teresa, earlier you mentioned basic needs being met. And I brought up the deinstitutionalization of 26,000 people. When they were in those institutions, they weren't all one who flew over the cuckoo's nest. I've been to a lot of the history. Each hospital has kind of a history, little place. And a lot of those people had day services every day. They ate lunch with people. They had a roof over their head. They had food. Now, many of those people, my brother-in-law being one of them, when he doesn't have those things, he's in jail or he's at ABH, which is the hospital down there. Now, luckily for the last 6 years, he had a house. He goes to a day program at the Gathering Place right there in Athens, and he has us, his family, to help take care of him. That's not everybody. So, and I sit here and think about this, and then going back to the payer piece, I can speak from experience. I have 3 kids on Medicaid, 1 with developmental disability, 2 on the mental health side, treatment foster kids, who will hopefully be mine. And then I have 1 who's on private who has mental health. The Medicaid's 10 times better because, the copays and all the other things, they don't, like, she doesn't want, like, Dad, I don't want you spending $40 or $50 for the copay. I'm sitting there thinking most families couldn't anyways. Like, we'll do it. But I sit there and think to myself, my goodness, look at the disparities and the parity in the private market versus the public. But anyways, going back to that, NAMI is one of our big things that we're advocating for, is around that support, the daily needs on top of the treatment. Because if people don't have a place to go and they don't have a place to live, how do we expect them to get better? I mean, it's a joke. And we all know these things. So I'll go to Tony. Here's the third question. And actually, Teresa started into this one a little bit. NAMI strongly believes the best solution for diverting people from the criminal justice system is prevention, early intervention, comprehensive mental health care, and a robust crisis response. And as we prioritize funding what do you think, what services or sports do you think is most vital to make sure on the front end we're going upstream to keep people out of the criminal justice system? That's a loaded question there.
Actually, I kind of cringed at this. I didn't like this question.
Okay, you reread it.
No. I mean, it's a good. I'll explain why I didn't like. But I didn't like it because if we don't fund prevention, then more people are going into treatment. We can't treat them. If we don't have treatment, then people don't get well. If we don't have aftercare, then they're just going to slide right back in the system, and it's just going to be this ugly circle. So we, to prioritize something is really kind of cutting our nose off to spite our face, which I've never understood that saying. But I've used it a lot though. I think a very short answer is I think if there should be no prioritization, because one without the other, it's just going to create like that balloon where you squeeze the one part and the parts go else, the air goes elsewhere. So that's my answer.
Okay. I believe that as we're considering how to, prioritize our funding, I believe that investing in those interventions that intervene early on, and respond effectively to crisis and sustain treatment in the community. I think that these are things that we really need to invest our dollars in, simply because these are the points in the criminal justice system in which we have the greatest impact on preventing justice involvement. So that's my rationale for saying invest in the prevention side of things, to prevent us from getting to the point of actual conviction and prosecution and being in the system. So early interventions and accessible community-based treatments are critical, in my opinion. Expanding outpatient behavioral health services, integrated treatment for co-occurring mental health as well as substance use disorders, and supportive housing, as we all spoke about earlier today. These things help to stabilize individuals before their symptoms begin to escalate into any form of crises or criminal justice contact. So early intervention. Secondly, I would say a robust crisis response system is essential, and investing in mobile crisis teams, crisis stabilization centers, behavioral health professionals responding out on scene with the police officers would be vital to provide safe alternatives to arrest, and emergency departments when an individual is actually experiencing an acute psychotic distressful situation. And lastly, I would say continuity of care and diversion supports must be prioritized as well. So ensuring that programs that connect individuals to treatment, to housing, to medication management, as well as to case management, particularly during the phase of an individual re-entering into the community, or being placed on community supervision. These things also help to sustain recovery, reduce recidivism, and improve long-term outcomes for individuals.
Teresa.
So I'll echo everything that's already been said, and you took almost all of my points, but that's great because it means I can say a couple other things, because I agree with all of that. And, it always has been about having a comprehensive continuum of care, and it should start with prevention. I want to point out, though, that the first thing that's usually cut in any budget cycle when you're dealing with the General Assembly is prevention, because they're always looking for outcomes in a 2-year budget cycle. Prevention is something, if we're doing, and we also need to make sure we understand we say prevention, what we mean. And I'm the stickler on this in any room I'm in, because when I say prevention, I'm really meaning like primary prevention, universal prevention, targeted prevention, before we ever get into illness. Many times in criminal justice and in child welfare, when they say prevention, they're really meaning treatment and early intervention, where you've got a diagnosis, you've got symptoms, and you're treating it. So we don't even say the same thing when we mean the same thing, when we mean something different. We use the word prevention because it's preventing deeper entry into a system instead of preventing entry into the system at all. And so those are the real challenges. You know, from a data perspective, we've done some research. Washington State has a whole compendium of what is the cost offset of doing evidence-based, true universal or early intervention and prevention. And the numbers, I mean, the average is for every dollar you spend in prevention, you get about $7 of return on investment. But it doesn't happen in a budget cycle. It's because it happens over the course of a lifetime. So when Governor DeWine talks about his planting of trees, prevention really requires that we're planting trees in every single person, in every human we're coming in contact with, around what does that look like. But I think the other data point we need to talk about, and the representatives brought it up in terms of data, is the economic impact. So for every dollar we spend in behavioral health, we get about a $5 return on investment. We know when we connect people to community-based behavioral health care when they're in Medicaid, their total cost of care is about 5 times less. 5 times less because they're connected, because somebody is doing the type of care coordination and case management that's making sure their basic needs are met. They have multiple complex health conditions. The average age of death, sadly, is still around 55. And that's not suicide-related death. That's death because of their untreated health conditions. We haven't moved that needle in 20 years because the current modal visit of people who come into contact with in healthcare saying, I have a mental health or substance use condition, is 1. They come 1 time and they don't come back. And they don't come back because there's payment issues, there's cost issues. They had to wait for 12, 14, 20 weeks to see a psychiatrist or a nurse practitioner or to get a therapy appointment, and then the cost factor. So all of those things are part of the challenge. And then I would be remiss if I didn't talk about the workforce challenges that we have. We know today in Ohio, every single licensed person would carry a caseload of about 380 people if we were treating everyone that had a need for a mental health and substance use condition. We know this is valuable work, but our workforce isn't valued. And so as we start to elevate the requirements and elevate the need, and I wholeheartedly agree, we need to do more and we need to create pathways for young people to come into these professions in mental health and substance use. We have credentials on the substance use side so that you can start and come in as a CDCA and start a career pathway. We don't have that on the mental health side. So we have a bill that's been introduced, House Bill 718, that would create entry-level mental health credentials so that there's because we have to start to create the pathway. We have to build the recognition of this workforce. And eventually we have to pay them better because they're doing really hard work. They work in very unsafe settings. They do a lot of engagement and outreach and community-based work, but they're not valued. And value is a paycheck. And I'll give you a real practical experience. When my daughter was in 9th grade, she's a freshman in college this year, we were sitting at the dining room table, and it's very clear she has no idea what I do for a living. And she says to me, Mom, do you know what social workers get paid? And I laugh because I'm like, I am a social worker. And I'm like, and I do a lot of workforce research. And I'm like, yeah, honey, I do. And she looks at me dead square on and she's like, why would anybody do that? They make less than teachers. So if our young people who are, this generation is so socially motivated, they are helpers. They want this world to be a better place. But they look at this, they want to be fairly paid, and they look at what teachers, they look at what social workers, at what counselors are paid, and they say, no, thank you, just based on salary alone, we're missing an opportunity. I believe this work is incredibly important. I've worked in this field for over 30 years. I know what I started when what I made when I started. It's incredibly rewarding work. And so how do we bring that generation in? But they want different things. And what they want is balance. They want work-life balance. They want to help, but they want to be fairly compensated. And we have to figure out how to raise the value. And part of it comes back to the services that we provide have to be paid by all payers in a way that allow us to pay people for the professional degrees that they have.
Joe?
Ditto. Everything, everybody's, oh,
Hi, I have a quick question. I want to know the bill number that you were referencing.
House Bill 718.
So again, ditto, everything they said. Prevention is something, the first words I wrote down here are crisis, right? That's the one that immediately comes to mind. We have to focus on crisis. I don't like this question either, Luke, for the same reason Tony doesn't like it. But the first words I wrote down were crisis,
I'll give you your
right?
money back.
Thank you. But historically, we've never funded and supported prevention work.
Yep.
We heard both of the reps say, we got to do something now because of this tsunami that is coming at us. Well, there's a tsunami coming at us because we never stopped the tsunami on the front end, right? But every time there are fewer resources, or we say there are fewer resources, or we are told there are fewer resources, it becomes this question of what's got to go. Well, somebody who is in crisis in front of you demands and requires and needs help. So we cut the prevention services, right? But I would push all of us to say, why are we even asking these types of questions? Why do we have to have these conversations when we're looking at a system that for 40, 50 years has been underfunded, underprioritized, and stigmatized? So why do we have to have these conversations about what should we be cutting and what should we be prioritizing? This is a system that has never been built. We're finally leaning into it. Let's get the job done. Let's take it over the finish line and start preventing these illnesses and spending our dollars wisely. Go look somewhere else if you say there's not enough money. Don't look here anymore. Stop it. I'm mad now. I got myself all
Well, we're going to
angry.
go to the audience. It's interesting, though. You were talking about prevention. We're a treatment foster home. We have a girl who's been through a lot. The therapist told us the other day, well, we're done with her. She's fine. And I'm like, you're done with her.
Yeah.
Because we're going to go to somebody else. But I also work in the system. My wife's an intervention specialist. Like, we know it's not over. Like,
Right.
There's a history of mental illness in the family. We've seen signs of it, plus with the trauma, plus with this, plus with that. And it's like, we know, because we work in it. We're 1%. Like, how many of the nine, and I worry when I look at across the state of Ohio, how many kids are, let's just use 14,000 are in foster homes. I've seen a number, 90% have experienced trauma. They go into foster homes, they never get treatment. They're going to be our crisis kids. I know it. So again, we've got to do more up front. And by the way, I think that means working with our schools, working with parents. I think the governor's on the right track when he talks about the younger we go, the better, because the DD figured this out a long time ago. My son's third grade IEP, I said, write down he's going to have his driver's license. They're like, okay, Dad, whatever. He drives, he makes $26,000 a year. He's no longer dependent on the system, because they invested up front in him through Project Search, through CTC schools. They paid for all of it. And guess what? Now he's paying them taxes. And we never talk about recovery. So that's my only thing. So were there any questions? I know this is scrolling up and I don't want to mess with this. Were there any questions up here? I saw one earlier, I thought. Is it being taped? Will it be? Yes. Yeah, and it'll be.
It'll be on.
That's a question I do not know. The answer is yes, and it will be on the AG's site. Stepping
I
up.
don't know how we can do it. The AG website's a little problematic. It will be on my website.
And you'll link it.
And we'll link it to.
In a newsletter.
Back there is taping it all.
Okay, yes. So yes, go ahead.
So I have a question. The state of Ohio last year expanded their reach with mobile crisis and response services. And that was done with the intention to basically strengthen the ability to directly meet the needs of Ohioans. But one of the things that we talked about, or the things that was mentioned, is that we don't necessarily invest or support prevention. So as it relates to mobile crisis response services, what are the things that are important right now that should be established so that we don't have to necessarily, if in a potential future, play defense for a crucial kind of pipeline to triage and treat individuals in need?
I mean, my first response is yes, we need all of it. We need to make sure, I mean, crisis is an intercept point where a person, you know, and mobile response for youth, the crisis is defined by the family. So it is not the same level of crisis that we think about in the adult system, which is imminent risk of harm to self or others. It can be broader. So in some ways, it does have a preventative bent to it. I think we have to continue to look at those models and best practices. And in the crisis space, I mean, you've heard us all talk about it. It starts with 988 and recognizing and helping our legislators, and I cannot say this loud enough or strong enough, understand that 988 is a service. It is not a call center. It is not like calling Discover Card or your bank and they're answering a question and giving you a survey. It is not like dispatch of 911. We have to help our legislators understand that 988 is a service, that I believe the number is approaching 90% of the time. That call alone de-escalates the family and meets the individual's need who called, whether they called, whether they chatted, or whether they were, texting with somebody. So call, text, and chat, all of them are important, and they're solving people's problems and creating a sense of connection and hope and help that is preventing people from ending up needing higher levels of care or being, having, suicidality. They feel a connection there. So that's important. Then we have to build out the rest of it. If there's a mobile response need, that we are understanding how the impact of 988 is then creating when we need that mobile response, and then having people to go. And it needs to be a combination of, first responders, whether that's EMS and clinicians or peers or case manager types, what that looks like, but having that response for both kids and adults. And we've got to pay for it. We have to come up with models on the adult side that fund it. We have crisis centers that we've invested in over the last 8 years. We don't have a funding model to sustain them, other than Adam boards are funding them, and there's some Medicaid billing, but they're really it. There's no Medicare funding for that. There is no commercial funding that's coming from that. So we have to find a payment model that sustains that. Those are really important pieces because that's the first entry into a system of caring. And I'm going to come back again and say, what you were saying and what Joan said about full stop, we shouldn't be asked to prioritize. You don't see hospitals saying, well, which heart procedure are we going to stop doing today? Or which orthopedic procedure are we going to stop doing today because nobody's paying for it? Why do we treat the brain differently? That when you have a brain health condition, that all of a sudden it's like, no, we shouldn't be preventing that. We shouldn't be teaching you about exercise. We need to be thinking of this as a complex and chronic health condition and demanding that the funding and the resources are comparable across the board and that we have a fully staffed workforce that can meet those needs. I mean, that's really the points that we have to come across. And when you come back and you think about our economy, Wright State did a study.
I kept the whole time you're talking, go ahead.
Wright State recently did a study, and we're actually working with them to expand this study statewide so that we have the data. And in the 9 counties around that, through the Greater Dayton Hospital Association, this was funded by and supported by the Chamber of Commerce, Wright State, the Department of Behavioral Health, and a local entrepreneur. $30 billion was the impact of behavioral health in that 9 counties. $30 billion. Economic impact. Only $3 billion was spent on healthcare, including behavioral healthcare. $12 billion of the impact was lost productivity. Some of it about caregivers. We don't talk enough about caregivers and the number of people who are not able to work because they're caring for a parent, they're caring for a child, they're caring for a family member who is impacted by their mental health or substance use disorder. 16 billion included other systems, but other systems ended up making about $2 billion of that 16 billion. 14 billion is lost life, people dying by the age of 55, because they're not there to fill the jobs that we have available. So when you take that 12 billion of lost productivity and the lost life because people's mental health or substance use condition is causing them to die early, and you wonder why we can't fill jobs. We can't fill jobs and all the jobs we're creating because we're losing generations of people to their illnesses that are highly treatable, highly recoverable. And we know a lot of the folks coming into our criminal justice system, particularly with substance use conditions, if we get them well, they bounce right back into their jobs. And if we can take and deal with these, collateral sanctions of having a criminal record and make them employable, we can fill those jobs. For Ohio's economy to be successful, I firmly believe if 25 to 40% of us at any given day are dealing with ourselves or a family member with a mental health or substance use condition, we're part of those numbers. We're part of the challenge of making sure that we have an economy that can continue to grow.
It made me think of the stat. We were putting together a blueprint for mental health, and it was person-centered mental health. 1980, Jimmy Carter did a study on how many people with severe mental illness are employed or not employed, and 90% are unemployed. The last study done by the federal government on people with serious and persistent mental illness, 90% still don't work. And again, I don't want to harp on this, but that would be unacceptable in the DD system. They have shut down their workshops because they feel like they're not inclusive. I'm like, our people will take them. I mean, let's let people with severe mental illness at least learn a trade like the people in the DD system, because then they become productive. And then going to the care, 80% of all caregiving for people with serious mental illness is done by family members.
Yeah.
And I can speak from experience. My wife or I every week miss a day of work. I work from home. She really can't. She's a teacher, so make a lot of. I thought most people could not do this. Like, you can't take kids to therapy appointments or all of a sudden the school calls because they acted up again. I'll be picking her up at 3:30 from detention today. It's like the fifth one. I'm like, when are you guys just going to do the suspension thing? Because it's behavior that then interfere with work. I'm sorry, but I'm like, it's another trip to the school doing the walk of shame as I walk in, and people don't understand. She's been through what she's been through. Most of us wouldn't be at school at all. We'd be in a treatment facility. So I'm like, this isn't bad, but at the same time, we just treat people with mental illness so much different than we do every other. You guys keep mentioning brain, developmental disability. We can list them out. By the way, I'll give a plug for 988. Is it still 80% of people call 988? They're able to actually serve the person to where they don't need to then do
It's
anything
higher.
else.
I think it's 85%.
Is it 85%? I mean, think of that number. If 200,000 people call and 180,000 people are diverted, we ought to be promoting that system left and right.
Sure.
Was it anybody else want to try to answer, or is that you guys good? Yes.
So with short story, my question is, how do we adequately advocate with managed care companies? Because what I'm seeing with our healthcare providers, it reminds me of when Pharaoh took away the straw and told the children of Israel, you still got to make the bricks. I mean, they are working with our most ill people, but they're spending all their time jumping through hoops trying to get a payment. And it's getting worse. And I'm glad that it sounds like we have some unscrupulous people that are going to be held to accountability, but I'm scared to death of what that stigma fallout is going to be from our providers. And we have a community that doesn't understand that you may have a marginalized return, but it's because it's a chronic illness. It's, we don't look at heart disease that way, we don't look at diabetes that way, but we still are looking at substance abuse and mental illness that way. So what do we do about that, and who can I contact at some of these behavioral health managed care Medicaid companies that they're withholding payment, and I have agencies that are going to go under if they don't start paying them for the services they provide?
Oh, there is so much advocacy going on around that right at the moment. I think it's just being willing to speak up. I think, it was, I think we were talking about the fact that we were a little surprised that that's where the Attorney General started some of his comments today around that concern. Yes, and so part of it is if there are bad actors, and however that's defined, and we need some help in clarifying what does that look like. Because we use the word good and bad without any definition of quality. Most providers in behavioral health are nationally accredited. And so if we've met that hallmark of national accreditation, which is a steep hill to climb, and if we're doing the right things, then let's focus on what we are doing well and what we are doing right, and let's solve the problem with the tools that we have to take those folks that are not, that are unscrupulous, that are intentionally gaming the system, but use scalpels rather than sledgehammers. And I fear the sledgehammers are coming, and we're going to see more administrative challenges related to as a provider. And so how do we balance that so that we don't lose workforce and we can continue to serve people? And so it is telling the story. It is using the tools that exist around provider, plans that aren't paying. Providers they can, appeal to the plan. They have to use their appeals process. There is a provider complaint form at Medicaid that you as a provider can submit a complaint and say they've not paid me and why. But then also understanding the plans are using tools like prepayment review and post-payment review. And those are there because that means there's something that they have found that's a trend that looks like it's not consistent with typical practice. There's going to be rule changes coming from the Department of Medicaid that will help clarify some things. So there's a lot of work that's going to happen, and we are going to have to allow for some changes that make some things tighter. We're not going to like it as providers. I represent providers all day, every day. But we're going to have to do what we can to make sure that we don't use this and push back on some of the administrative costs that come with being in a managed care environment. And then thinking about commercial insurance, who doesn't pay us, that pays us even less. And why is that? And why is that allowed to continue? Because what happens is people spiral down on their private health insurance until they lose their job, they lose their relationships, they lose their resources, and then they're in Medicaid. So there's a cost shifting from the private sector into the public sector, and we have to continue to push on equity and value. And what's happened in the marketplace is a lot of the clinicians just give up. And they're like, I'm going to go into cash-only private practice because there's so much demand that people are paying for cash out of pocket. And I'll say that, and I'll say it personally. When I had children who needed help, trying to find a pediatric social worker, well, I could find them, but I have really good health insurance, and it meets parity because I make sure of it because of what I do every day. I called 12 people that were in network. Only 2 called me back. Both of them were moms who worked during the day and said they saw kids. So they'd see my child, but only if I could get her there between the hours of 10 and 2. Mm-hmm. She was in school. So what did I end up choosing to do? Because I could, I paid out of pocket. And most families today, if they can afford it and they're finding ways to afford it, are doing it. But I've worked with families in my own community, people that I know, who are like, I can't afford that. For my kid to be seen twice a month is the same as making another car payment.
Well, and as we'll kind of close, recently some of the changes that were being proposed by some of the companies from a consumer perspective, as individuals and family members, capitation, prior auth on a day service of people with severe and persistent mental illness. You go to 2 days a week, that means the other 3 days they're walking around the community. We're back to the criminal justice system again.
Yep.
Because what you've done is you've taken the sickest of the sick and you put them out on the street without any treatment. And you think, it's a great idea because you're saving money because somebody cheated the system somewhere in, some other county. But the provider, who's also on my board, called me and said, do you understand what this is going to do to about 50 people in Cleveland, in my little mental health center? We don't make any money on this service. They're going to be walking the streets. And then they're going to be calling me, why aren't you guys treating? So, and again, the families are stuck with it. So we're going to end right there. And I'm going to hand it back over to Justice Stratton to close out. Thank you all for the panel. Thank you.
I want to thank our panel again. A lot of them traveled 7 hours to come in person to present this. And so and I know that some of them will travel to come. And hopefully there's a lot of people that will stay online. It will be recorded. Steve Miller and John site for me pretty much has everything I do. I don't know how to run it when he really retire, because he's retired 6 times already. I don't know what he'll do with the website, but I'm going to be doing a summary of what it offers in the newsletter that you all should be getting, so you know how to access it. He's taped countless things over the years. They're almost all on there. All the stepping up stuff is on there. The steering committee stuff is on there. The webinars that we put together with all the different committees, like the trainings and the programs we've done at the schools are on there. So there's a lot of wealth and resources. And I thought, well, yeah, I need to let people know about this, because we've had trouble with the AG's office, the tech department, trying to get some of the stuff online. And I don't think we still have succeeded to do that, but they could link it. So we're going to try to do that. So thanks to our 2 leaders. Zach had to run off and deliver them back to the legislature. And thanks to Luke Russell for his hard work in putting his panel together. Again, for the panel members that came, we very much appreciate it. And we'll aim for another one, probably our last one of this term. I'm working with the AG candidates to try to keep this thing going. I'm very optimistic that no matter who wins, it will keep going. So hopefully you can all just plan on keeping on trucking. So again, thank you. Grab somebody that you haven't seen for a while for lunch, and before you head back to wherever it is, and we'll see you again soon. Thank you.